I'm just asking on a human nature. Surely you apologise to my listeners who lost relatives.
Well, I recognise it's devastating, and my heart goes out to any family, any of your listeners where
Minister,
they
what's
lost a
so
loved one.
hard about the word sorry?
Because we followed the scientific advice that we had at the time, Nick, and we moved.
We'll move on in a minute. I mean, there's no point going on and on with this, Mr. Barclay. But on a human level, as Minister for the Cabinet Office, you can't apologise to people who lost loved ones.
Well, I'm saying if we followed the scientific advice and the
Hey everyone, welcome back to Political X. For more knowledge and updates on UK, European and US politics, make sure you subscribe to this channel. So I wanted to touch base with everyone this week on this Burke, Mr. Barclay, who is from the Cabinet. He's a Tory and has very little empathy and inability to say sorry. Really weird, even on this, when the reports come out, it's been backed by Tories, it's been led by Tories, and yet still this government can't say sorry for huge mistakes they've made. So let's have a listen to him talk to Good Morning Britain.
This is an absolutely devastating report. This was one of the most important public health failures this country has ever faced. And from the start, it appears we did not take the measures seriously enough. We didn't go hard, fast, or early enough.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. And I think it's very important that people obviously can make up their own minds. I think that Matt has said that people must make up their own minds, but I think the scientific evidence is, well, I'll hand over to the experts. But our judgment is wash. Washing your hands is the crucial thing.
What do you say to that accusation?
Well, we did take measures. We deployed the vaccine at pace, and I think saved many lives by doing so. We acted quickly to protect the NHS. We followed scientific advice throughout.
Did you really? Or did you ignore the WHO? Did you ignore what was taking place in Asia? More likely, you ignored that. Let's have a listen to what Dominic Cummings had to say about the response.
The second most powerful official in the country, Helen McNamara, is the Deputy Cabinet Secretary. She walked into the office while we're looking at this whiteboard. She says, "I've just been talking to the official, Mark Sweeney, who is in charge of coordinating with the Department for Health. He said, quote, I've been told for years that there is a whole plan for this. There is no plan. We're in huge trouble."
We were in trouble. We arguably still in trouble. We're still suffering from this. You might go, oh, it's Dominic Cummings. How much do you want to believe this? There's a ton of evidence out there. So, for example, I'm pretty sure everyone's aware, we didn't have any PPE. Let's have a listen to a doctor showing the craziness that was taking place with the PPE situation. You can't say to people for this amount of time these gowns are disposable and then the next day say, oh, actually, we've changed our mind. That is the difficulty. If they had from the very beginning said we can safely reuse equipment, then it wouldn't be a problem. The problem is that it's constantly changing because it's very much reliant on the stock, not the evidence. But it gets worse, if you can believe it or not. Have a listen to this.
The government does stockpile PPE for pandemics, and that has been incredibly important and useful in our response to this.
So having a huge stockpile sounds really good and promising, so at least they've done that. However, 190 million masks had expired, 116 needles and syringes expired, 28 million respirators expired. Out of the 26 million respirator masks, 80% were expired. Some were 3,000 days out of date, that is nearly a decade. 53% of the surgical masks were expired. All needles and syringes expired. In total, 45% of the personal protective equipment had expired. Now, I've read through the report. It's been pretty interesting to read through it because there's no mention of the track and trace system not being operational. It does talk about preparations, doesn't mention that, doesn't mention PPE, doesn't mention the borders not being closed. It does obviously criticise, and there's other stuff to come out, but I was quite surprised that they talked about preparations and they didn't talk about the lack of it. But then again, The person who was in charge for 7 years of all of this, Jeremy Hunt, was leading that investigation, which beggars belief, frankly.
Grant Shapps has literally done the opposite of the world as Transport Secretary. He has done nothing. I would ask him what on earth he's been doing for the last 9 months. No airport testing, screening or measures since the pandemic began. None. No temperature checks, no health assessments, no flight restrictions throughout this entire pandemic. No measures to have air travel actually acknowledge we're in a pandemic. The lack of measures have contributed to the worst death toll in Europe, and he detailed what every other country has been doing. So I put it to you, what have you done?
Now, I had the misfortune of going through the airports during the pandemic. I was trapped in Norway, came back over, and it was almost like chalk and cheese. When you looked at what was taking place inside the Norwegian airports, calm, spacing, not many people around, and the police were taking it quite seriously. They were marching up and down, making their presence very much known, that you were to be separated at all times. Came in through Heathrow, oh my God. It was just pure anarchy, frankly. There was nothing on the loudspeaker telling anyone what to do. There were no posters up informing anyone. Security guards did have masks on, great, when you were coming through the gates, but they didn't say anything or tell you what to do or where to go. When you went through to the luggage area, I saw police officers and security officers stood in a circle, having a bit of a gas and a laugh with each other. No more than maybe half a metre separation between any of them. There must have been about 4 of them. But while that was going on, around the conveyor belt, there must have been about 40 to 50 people all sat around trying desperately to get a hold of their luggage and get out of there. But of course, they were so close to each other, it also meant that they were transmitting. That's how bad our system was. No plans in place all the way through. I happily go on record and say I witnessed it. Total joke. The other thing I found interesting was there was no app that you could get instantly. That should have been ready to go from the start. This is Snake. It is one of the first apps you would have found on your phone. This is an app. This is how far back we could have begun preparation for a pandemic app, and yet nothing has been done. Not until the very last minute, and it has cost us over 30 billion. Germany's has cost 1 billion. That tells me the government panicked and just did whatever it could to get a hold of software engineers who completely exploited them, probably in part down to their ignorance of understanding how much this type of stuff actually costs to produce. But also because we weren't prepared, and as a result, we're having to scramble around last minute and fork out extortionate fees to get people off their current contract to come and work and develop an app that should have been developed 10, 20 years ago. But the next thing that didn't exist was any coverage, financial support for anyone who was ill with COVID. So if, let's say, you were on 2,000 a month, okay? And let's say you've got to take 2 weeks off because you've got COVID. That means that potentially your wages drop to £1,000. And then you're given 90 quid per week that you're ill. So that's 180 quid. So your wage has gone from £2,000 to £1,180. For a lot of people, that is not an option. And yet the government, including Rishi Sunak, has gone on record repeatedly that they did a good job, and this is why I'm pulling up Stephen Barclay today, because he's a muppet.
You will now be entitled to the minimum statutory sick pay of £94.25 a week from day 1, not day 4 as previously. But to qualify, you must earn at least £118 a week before tax. That means that many low earners, around 2 million people, stand to lose out, as well as the self-employed, around 5 million people, or many on 0 hours contracts.
So if you're poor and you're ill and you have COVID, you've got a choice. £94 a week and starvation, or go out and earn but spread COVID. Great choice. You can tell these people in charge are excellent at their job when they come up with solutions like this. So let's go back to the question and then see the response.
This is an absolutely devastating report. This was one of the most important public health failures this country has ever faced. And from the start, it appears we did not take the measures seriously enough. We didn't go hard, fast, or early enough.
But you're right, there will be lessons to be learned. That is why we have committed to a public inquiry.
So he agrees that there were mistakes, but that's why they've done a public inquiry, as if that absolves them of all those errors that they are responsible for. Let's have a look at what New Zealand did during the same time frame.
This Joint Select Committee's inquiry found pandemic planning, for instance, was based too closely on the flu model and not on other respiratory diseases like SARS or indeed coronavirus.
New Zealand had a pandemic plan and it was designed around the flu.
It became apparent that if we followed the steps in our pandemic plan, we would go down the track of other countries and not being able to manage the outbreak in our communities. So we had to change tack.
So that's New Zealand's response, slightly closer to Asia and where it's having an outbreak. Let's have a listen to what Barclay's response is.
We were dealing with an unprecedented situation. It was a global pandemic. People were learning about the virus as we went along. There was no perfect scientific view.
Excuse after excuse after excuse. Right, let's have a listen to what New Zealand did and how they responded to all this. And we're going to look at what the WHO said about New Zealand's response.
There were some countries who initially talked about herd immunity as a strategy. In New Zealand, we never, ever considered that as a possibility, ever.
And it's important to recognise it's not to stop everybody getting it. You can't do that. It's not possible to stop everybody getting it. And it's also actually not desirable because you want some immunity in the population.
Herd immunity would have meant tens of thousands of New Zealanders dying, and I simply would not tolerate that, and I don't think any New Zealander would.
Perhaps you could sort of take it on the chin, take it all in one go and allow the disease, as it were, to move through the population.
We currently have 102 cases, but so did Italy once.
We're not doing the things that sometimes perhaps are happening elsewhere just because it seems like a populist thing to do.
It criticised the contain and delay strategy, saying the government was fatalistic, had accepted that herd immunity was inevitable. It said it was a serious mistake to stop community testing early in the pandemic.
Sweden pursued a policy of herd immunity, which most scientists thought was nuts. It now turns out it was nuts. It's also true, because we know this from Patrick Vallance, that we were pursuing a policy of herd immunity right to the point the modellers came back and said it would cost 500,000 lives, at which point there was a screeching U-turn. That was another one of the terrible mistakes that we made in the early stages of this pandemic.
I think it is also the case that it's important that you should clarify that the UK government was never also pursuing a policy of herd immunity.
Well, Patrick Vallance said, actually on Radio 4, on record, on tape, that that's exactly what we were doing. And so when you guys say we weren't doing it, why did no one tell the chief scientific advisor? Because he was under the impression that's exactly what we were doing.
Advisors advise, ministers decide. That was
You
never
were
the
following
policy
the
that we were
science
following.
at the time. Do you remember? You told us every single day we are following the science, not guided by, not listening and making our own decisions. We're doing what the scientists tell us. Your chief scientific advisor, on I think it was March the 16th, on Radio 4, around that week, he said quite unequivocally that we were following herd immunity.
But the trajectory is very clear. Act now or risk the virus taking hold as it has elsewhere.
Things like closing schools and stopping big gatherings don't work as well, perhaps, as people think.
We have, for instance, 9 million protective masks already here in New Zealand, should we need them.
Reports that some NHS trusts are running out of protective equipment has caused huge concern.
Due to shortages, we would now have to share masks.
We're still, and will continue, to track and trace every single one of those cases. We know where they came from, what links to overseas travel, who those individuals were in contact with, so that if someone in that contact group then has COVID, we can continue to trace the line of how people came in contact with it.
People were transferred from hospitals into care homes to release pressure on hospitals, but without being tested first. So they were, in effect, carrying the COVID-19 into places where there were lots and lots of vulnerable people.
Every person entering New Zealand will be required to self-isolate for 14 days. These are the toughest restrictions in the world.
Still today, you can continue to fly into the UK with no checks, no measures, no screening, no tests, and no quarantine.
Apply a simple principle. Act like you have COVID-19.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
Because we believe that decisive action, going hard and going early, gave us the very best chance of stamping out the virus. And it has. We have done what very few countries have been able to do. We have stopped a wave of devastation.
Because I know there will be many people looking now at our apparent success.
Britain is on track to record one of the worst coronavirus death tolls in Europe.
We were following the advice that we received, but everyone was learning from the pandemic as we dealt with it.
As you can see by my argument and what you've seen in those clips, some people learned a lot quicker than we did. And I am 90% certain there was an element of looking down on Asian countries as inferior and not knowing what they're doing. And we had our superiority complex kick in, and we didn't want to listen to what the Asian countries were saying. And that's why we had a problem. And yet the New Zealanders and the Australians looked at what they did, quickly took it on board, and set up a plan. But the other difference is they obviously had other plans in place. They said it had one for flu, and I'll bet a bottom dollar it was better than our plan, which apparently was none. Bear in mind, this man's on TV defending their position, yet no PPE, no track and trace system, no plan whatsoever, no control of the borders, nothing. And yet he's out there defending the record. Don't get me wrong, it's great that they had the vaccine rollout and it went so quickly, and that they listened to Bill Gates, who said, don't use waterfall, use parallel project management to get this over the board. In many ways, if you were to do an equivalency with World War II, this has felt like we got absolutely kicked left, right and centre, and luckily our scientists pulled off the creation of an atomic bomb. We didn't win a single battle because there was no plan or preparation to deal with the Nazi threat, or in this case a virus threat. And luckily we managed to pull out of nowhere a nuclear bomb.
Of course, nobody is doubting that the vaccine was hugely successful, but that came very, very late on in the pandemic. We were late to lockdown. The report says if we'd locked down a week earlier, 20,000 lives could have been saved. Now, if you're one of those families who knows that your loved one could have been saved if we'd gone a week earlier, you'd be absolutely furious this morning with the government. What do you say to those families?
Well, my heart goes out to those families. It's absolutely devastating. And there will be lessons.
Mr. Barclay, whose fault was it that we were late to lockdown?
Well, I don't accept that we were late to lockdown. We were dealing with the information.
The report says if we'd gone a week earlier, 20,000 lives could have been saved. I mean, that means that we were late to lockdown.
I'm not sure if he's not saying sorry because that would then give him culpability and then he could get sued, which I would suggest to all of you to look into corporate manslaughter for what they've done if you've been affected. And then the other thing is it just a case that politicians don't apologise? Because if they apologise, they're going to get it in the neck. And if they don't apologise, they're still going to get it in the neck anyway. So just don't apologise. So bear that all in mind of what he's just said, that they haven't done anything wrong with the planning, even though there was no plan, and I've given enough evidence for that. I'll add this, there still seems to be this element of arrogance within the system of let's not pay attention to WHO, let's not pay attention to Asia, and it's cost us.
New Zealand had a pandemic plan and it was designed around the flu.
It became apparent that if we followed the steps in our pandemic plan, we would go down the track of other countries and not being able to manage the outbreak in our communities. So we had to change tack.
Well, as I think you yourself have debated on the programme many times, there is a wide range of views amongst your own viewers in terms of whether we locked down too much for too long, whether we didn't lock down enough. There's a wide range of views on that. Chris Whitty, as the Chief Medical Officer, said...
establishes we were late to lockdown and could have saved 20,000 lives. My question to you is, was that a scientific mistake or was that a political mistake?
Well, as Chris Whitty himself said in October, there's no perfect time for lockdown. There's a range of factors.
New Zealand had a pandemic plan and it was designed around the flu.
It became apparent that if we followed the steps in our pandemic plan, we would go down the track of other countries and not being able to manage the outbreak in our communities. So we had to change tack.
That are considered, and obviously what we know now is very different to what we knew at the time those decisions were being taken. For example, at the time of the first lockdown, one of the principal concerns was that we wouldn't be able to lock down for a long period, and therefore the timing of that had to be at the optimum time because of the limited duration that people would endure a lockdown for.
Literally, what planet were those advisors on? I don't understand. How have they forgotten this historical context of this split spirit that has been banged on about all the way through Brexit? And they thought that the British wouldn't take on board some of these ideas. It's absolutely mind-blowing. To me, it says, one, they're totally out of touch, and two, why haven't they been sacked? Why haven't we heard some sort of report of them being sacked? I haven't heard of anyone being sacked. In fact, this government has this tradition of not sacking people. Like, there have been massive mistakes, 20,000 deaths. No one's been fired. No one. It's abysmal.
We now know, after the course of the pandemic, that actually people were willing to endure a lockdown for a much longer time than was originally envisaged.
So the point is, misjudged the public then?
Knowledge on these issues.
Is that the answer? You misjudged the public? Because in fact we were incredibly compliant when it came to lockdown, weren't we?
And there was no perfect information from which to learn.
Except there was advice, there was WHO advice, and if you followed it, chances are you're going to have a lower death rate. Again, not being challenged enough, and he's a slippery fish.
We did follow the scientific advice, we did save lives, we did protect the NHS.
Was he listening? It's in excess of 20,000 dead.
We were late to lockdown. The report says if we'd locked down a week earlier, 20,000 lives could have been saved.
Don't think I'm going to say much more. I'm going to let Susanna sign it off because she's pretty brutal with him, and she did go through it and was with peers and watched these idiots get on TV and say the most mind-numbing, crazy, anti-pandemic stuff you'll ever hear in your entire life. If you'd like to buy me a coffee or become a patron, links are in the description. Always appreciated. And I'll say on top of that, I have a more extensive video on this topic, and it's at the top of my description in my homepage. So please check that out. Let's go back to Susanna.
I just wonder, you have heard that tens of thousands of lives could have been saved if your government had done things differently. Do you feel that on your conscience? Would you want to, as a government, offer an apology to anybody whose life has been devastated by those catastrophic mistakes?
Well, Susan, I absolutely recognise the devastation that many families have faced. That's why back in May, the Prime Minister was very upfront in saying that the government takes responsibility for everything that has happened and is sorry for the suffering that people have experienced. And we're keen to learn the lessons from that.
And I have to say that the majority of people are surprisingly forgiving and are actually saying that they understand that, the reason for some of the mistakes wasn't malpractice, but it was basically scientific ignorance. We didn't know enough. There are others, however, who are extremely angry, particularly those who lost loved ones in care homes when their relatives were sent back when they shouldn't have been. But on the whole, you seem to be getting away with it.
No,
Certainly as far as our viewers are concerned.
I take issue with that.
Do you? Go on.
Yeah.
You-
There's a litany of mistakes, Steve Barclay, and I'm afraid you haven't got away with anything, as this report shows. You know, too many things were done too late.
I hope you enjoyed my political observations this week. If you'd like to support me, please share the video with others and post about it on social media. If you're keen for more, subscribe, comment, like, and hit that notification button. Thanks for listening, and see you next time on Political X.